Hello everyone, welcome to Dental Shots. Today's video will be on slob. So this is the technique which we use in radiology. So what is this technique slob means? It means same lingual opposite buccal. So in this video we are going to see how we are going to imply this technique clinically. Okay. So the principle behind this slob radiographic technique is that you always relate the tube head, that is the radiographic cone head, with that of any object or any anatomical landmark or any pathology or any landmark for that matter. So for example, the cone is there. Okay, this cone, when you move, for example, to the left side, okay, you have a three roots and you have to know whether this root is buccally placed or lingually placed. To find that, first you take a normal radiograph. Okay, in that situation it seems to be here, and when you move the cone to the left side, when this root also move along with the cone direction, the cone is moving left side and this object is also seem to be moving towards the cone region, then it means same lingual. So the object is in this root is mostly in the lingual portion. Okay, and when you move the cone to the right side, okay, but the object which you are concerned of is moving in the opposite direction, that is in the left side, so it means it's moving, the cone is moving right side but the object seems to be moving away from the cone, then opposite buccal. So the object is moving in the opposite direction, so it means the root is buccally placed. So it is like a tube head. When you move, when the object also moves in the same direction, and it means the object is lingually placed. When the tube is moving in one direction and the object is moving in the other direction, that means the object is buccally placed. So with this implication, what we are going to find out, the canals where it is located, lingually or buccally, or the root as such, how it is positioned, and fracture, whether it is in the lingual or buccal, any perforative defects, any cyst, any resorptive defects, and any foreign bodies, whether it's lingually or buccally positioned, and any landmarks like anatomical landmarks, and to distinguish any superimposed imposed objects. So find out all these things. The slob technique is more important. Only thing you have to remember is that same lingual opposite buccal. When the tube is moving in one direction and this object is moving in the same direction, then it's called lingually positioned. This object is lingually positioned. When the tube is moving in one direction and the object is moving in the opposite direction, then the object is in the buccally position. So if you remember this, it will be useful for many of your clinical implication in dentistry. If you like the channel, kindly subscribe. Thank you. Have a great day.